All right. Welcome to today's edition of the South Central Telehealth Resource Center Telehealth Roundup series. Thank you for joining us today. Today we will be talking about telehealth technology trends presented by our friends at the Telehealth Technology Assessment Center. My name is Joe Schaffner. I will be the moderator for today's session. I'm the Assistant Director of Outreach for the South Central Telehealth Resource Center, located with the Institute for Digital Health and Innovation at the University of Arkansas for Medical Sciences. And I have nothing to disclose. So before we get started, and as I'm going through my riffraff here, I'd like to throw a poll out there just to kind of gauge attendees' experience in telehealth today. So if you can, feel free to answer that for us so we can get some quantitative data. So as you're doing the poll there, just want to go over what the South Central Telehealth Resource Center's role is among the larger picture of the consortium of the National Consortium of Telehealth Resource Centers. So we are one of 12 regionally based telehealth resource centers. You can see us in the map there in red. We represent Arkansas, Mississippi, and Tennessee. And if you're joining us today outside of that area, contact us after the webinar and we can put you in contact with your local TRC, or we can help you as well. We're a big family here and we all work together to get the job done. So other than the other 12 regional telehealth resource centers, there's 2 national telehealth resource centers. One of them will be presenting today. The Telehealth Technology Assessment Center is our go-to place for things technology related. They have product reviews, workshops, great free resource for you to utilize. And we also have the Center for Connected Health Policy, which is our go-to source for all things policy related. And as I'm sure most of you know, policy is very fluid, as with everything else these days when it comes to telehealth. So what do TRCs do? If you're not familiar with us, we try to meet you on your road to telehealth and get you where you want to go, whether that's talking about equipment, policy, guidelines. Um, if you find yourself in a telehealth pickle, like you don't know where to go from here, billing and reimbursement has got you in a conundrum. We have funding available that might support your growth and development and your knowledge and awareness with telehealth. So if you're interested in growing your telehealth knowledge and awareness, contact us after the webinar and let's continue that discussion. I want to encourage everyone to go to our website. We have a wealth of information there, videos. We have a podcast. We created a special page just for response to COVID-19. It's our telehealth assistance for providers page, and there's a wealth of resources there at your fingertips. All of this is free. We encourage you to check it out. And here's our contact info. And I'll put this up in the chat box. So keep your eye out on the chat box. I'm gonna be putting links up there. I'll put my email address up there. And I'm also gonna put a link to our telehealth landscape survey. We wanna hear from you. Are you using the TRCs in your region? If so, how well are we doing? We wanna hear from you. So please take time to fill that survey out. So with that being said, I am happy to introduce today's guests. We have Doris Barta, the director of the National Telehealth Technology Assessment Center. She has over 20 years of experience working in the telehealth field, serving in the capacity of a telehealth network director, as well as in the role of a fund development for telehealth. Ms. Barta also has worked in the principal investigator as the principal investigator for the Northwest Telehealth Resource Center for the past 10 years. She brings a wealth of experience in program planning and operations to the Technology Assessment Center team. We also have Jordan Berg, who is the Technology Assessment Specialist at the TTAC and Resource Center, one of the 2 national telehealth resource centers, as mentioned previously, which provides in-depth objective assessments of all types of telehealth technology. Jordan has over a decade of hands-on experience working with the Alaska Tribal Health System and 6 years experience working in telemedicine. Jordan is passionate about working with people, helping them understand evaluate, and assimilate telemedicine technology. Ladies and gentlemen, the TTAC crew.
All right. Thank you very much, Joe. Let me just get our slides up. Um, so, Jordan and I are excited to be able to present to you all today about trends that we are seeing in telemedicine. So let me just share a little bit about us. You know, as Joe said, TTAC is one of the two national telehealth resource centers. The other one is a Center for Connected Health Policy. That's the policy TRC. And our job primarily is to provide services to the 12 regional telehealth resource centers with regards to their questions or information that they're seeking for their colleagues with regards to telehealth equipment and assessing that technology. We have three staff. We have Garrett Spargo, who is our PI, and in this photo, he is looking into Jordan's eye. As Joe said, Jordan's our technology specialist. And between the three of us, we have over 50 years experience in the world of telehealth. So what does TTAC do? Like South Central, we have a wealth of information on our website. We have a number of toolkits that we have done that have where we've assessed various medical peripheral equipments. We also have some innovation watches and videos on telehealth applications. Usually, we also do what we call a technology showcase, where we actually take the technology and we bring it to a regional conference so that you, as the audience, get an opportunity to look at the technology, trial it out, and make some assumptions on that technology for your own organization and how you would like to promote or use telemedicine. Now, because we are federally funded, we're vendor neutral. So all we do is provide you with the information about the technology so that you can make an informed decision. Now, as Joe said, we are members of the National Consortium of Telehealth Resource Centers. All 12 regionals and two nationals are members of the NCTRC. And together we have put a wealth of information on the NCTRC website. So if you get a chance, go to that website at www.telehealthresourcecenter.org to take a look at the information that we have posted on that website regarding developing a telemedicine program or expanding one that you already have. So as Joe showed you the map, this is actually an interactive map that's off of the NCTRC website. So if you, for example, South Central is the burgundy color group there, all you would have to do is click on one of those three states and that would pull up information for Joe, Wendy, and Hari for you to access them. Now, if you wanted to go to any of the other regions, you could do the same thing. Or if you're interested in one of the two national TRCs, all you would have to do is click on that icon and the site would drive you to one of those two TRCs. So today we're just going to give you a little bit of an overview of what we're going to be talking about today. We're going to be talking about trends in telemedicine technology, and we're going to focus on video platforms and how telemedicine has changed with the current COVID-19 crisis. We will be talking about trends in web-based video platforms that we are seeing that people are using for providing telemedicine care. We will talk about some of the key considerations that organizations need in making a selection for their platform. This includes security and privacy. That's very important when you're making those kinds of decisions. We'll talk about broadband and most specifically how broadband is affecting rural patient care. We will discuss some technology considerations for the providers and patients. We have a video assessment that we've done on video platforms that we will share with you. And in the end, then we will leave you with some key thoughts with regards to telemedicine trends in general, and most specifically with regards to COVID. So, I'm sure it's not a surprise to any of you that COVID has made a significant change in how we are delivering telemedicine care. And as I saw on the poll, we have about 80% of you have some experience or are experts, kind of big deals in telemedicine. So it wouldn't be a surprise to you that organizations are really wanting to get functionality up as quickly as possible. And so what we are seeing is an increased need for web-based systems because they can be set up real quick. The other thing that we're seeing is a real movement towards a direct to patient in the home care. So, and that's logical, right? We're wanting to see our patients. They can't come into the clinic. And so we are setting up systems where we can provide that care to the patient in their home. Now that means we're using the patient's technology. We're using their laptops or their iPhones or their tablets. We're using their consumer grade Wi-Fi or cellular service. It also means that patients and providers alike are really wanting to use systems that use a simple connectivity like email, text messaging, or even a patient portal. And they're expressing an interest in using systems that don't download something to their technology. So they're really not wanting to use up some of their memory on their device. We've also seen a significant movement towards mobile platforms um, that uses technology that has USB plug and play. And Jordan's going to do a demonstration with some of that technology for you later. We're also seeing where providers and patients alike are wanting to have systems that are simple and easy to use, right? So they would have a link for you to connect to them. They get an invite, they click on to the link, and then they're in the meeting. Now, although this is convenient, it really does not provide a robust enough video in a rural environment. And also, we need to be concerned about security and privacy with that kind of a connectivity. And then the other thing that we are seeing is organizations are really wanting a one system for their whole organization. So rather than having something for administration and education and then something else for clinical, they really are moving towards platforms that allow them to use it in administration, clinical, and education so that they're not having to switch back and forth and learn more than one system. So the other thing that we are seeing is, as we are looking at new platforms, we really need to be thinking about what are some of the platform dimensions. For example, deployability, how rapidly can you deploy this system into your clinical environment? In addition to deployability, how soon will you be able to use it with your patients? How fast can you scale up the system? And we've seen some real issues with this as people went from providing just a few clinical encounters a week to hundreds of clinical encounters a week. And how fast can you scale up to provide that? And does your system allow that flexibility to scale up to that much use? And do you have enough licenses, for example, to be able to scale up to that? And then how reliable is that new system for patient care? And finally, ease of use. As we have a lot more providers and patients in this space that we've ever had before who have never used telemedicine, how easy is it to train them on the use of this technology? So we need to be considering all these things when we're choosing a platform for telemedicine use. And in the middle of all of that is security and privacy. So, security and privacy has really been a hot topic button with telehealth, and especially, in the last 6 to 9 months. So we are seeing two forces that are affecting security and privacy during COVID. And one of them is a relaxation of the HIPAA compliance and other regulations around platforms that can be used in delivering care. Now, what this has done is allowed clinicians to connect and be reimbursed for using non-traditional telemedicine technologies. So the Office of Civil Rights published a notice on the types of technologies that can be used and are not appropriate for patient care. So they most specifically named FaceTime, Facebook Messenger, video chat, Google Hangout, Zoom, and Skype as potential technologies that could be used for patient care, although they admitted this was not an exhaustive list. And then they also named technologies that are not usable, like Facebook Live, Twitch, and TikTok, sorry. So as a rule of thumb, if it is not a platform that is designed for one-on-one and it's more designed for broadcast or a large communication, then it's really not a viable telemedicine platform under the discretionary notice. Now, we also realize that this relaxation of rules will probably quit once the pandemic is over. So as you're building your program, you consistently need to be thinking about your security and privacy issues around that development of your telemedicine program. So the other issue that we are seeing is concerns regarding the relationship with the service provider and their role in the security and privacy of your telemedicine program. Now, this may center around maybe users not understanding the security and privacy that is built into the system that they're designing, or they may not have developed accurate or adequate policies and procedures around controls of their video conferencing system. The other thing that we're seeing is some concern about how the technology provider is using your data. So regardless, we are seeing some real growing pains around organizations, vendors, and consumers as they're dealing with these new ways of providing telemedicine care. So next, what we want to do is show you a recent assessment that we did on web-based video platforms. And then after this video is over, Jordan is going to talk about how we conducted the assessment, and we'll share with you some key trends in video platform technologies.
TTAC recently conducted some network stress testing of several video platforms. We streamed a standardized test recording over a network with varying levels of simulated degradation, including low bandwidth, delay, and packet loss. We then recorded the resulting video and audio at the receiving end. In the following video, you will see comparison views of 8 video platforms, recorded at a network speed of 512 kilobits per second. The recordings are synchronized to the source video and audio in the center of the screen. Following this, you will see a brief labeled clip of recorded test footage for each platform. Additional test footage and other related content will be published in the coming weeks.
It takes a lot of help to finish these. Mark the spot with a sign painted red. Take 2 shares as a fair profit. The fur of cats goes by many names. North winds bring colds and fevers. He asks no person to vouch for him. Go now and come here later. A sash of gold silk will trim her dress. Soap can wash most dirt away. That move means the game is over. It takes a lot of help to finish these. Mark the spot with a sign painted red. Take 2 shares as a fair profit. The fur of cats goes by many names. North wind bring colds and fevers. He asks no person to vouch for him. Go now and come here later. Soap can wash most dirt away. That move means the game is over.
Okay, so thanks for watching that little quick video. That just gives you a quick intro into the assessment that we recently did around these video platforms and connection speed. We wanted to kind of show you what it looked like and kind of give you a small subset of the results. But if you're interested in viewing some more data, if you go to our website, we actually have a longer video where each platform gets a full time with the 60-second clip. So you can watch a 60-second clip of each platform and see how they kind of compare with each other. But let's talk a little bit more in detail about what we kind of did and some of the key trends that we observed. The diagram that you see here is useful for kind of understanding what we did and kind of how we set it up. By using a network emulator between two video platforms playing the recording, we were able to really put these platforms through a stress test where we were able to subject them to variable bandwidth. We were able to insert some packet loss. We were able to insert some digital delay. And with those features, we were able to see kind of how they might perform in a rural or a poorly connected location. In our evaluation, we were really looking at 4 key criteria for rating these platforms. The first was connectivity. We wanted to see kind of how long it took different platforms to connect, how easy were they to connect, and how stable that connection was over time, even if the connectivity was variable after we connected initially. We wanted to look at video quality, primarily concerned with the quality of the images that we got, including frame rate, resolution, the quality of the color, and just the overall clarity of these platforms. Next, we wanted to consider audio quality. So voice clarity was assessed at all the different speeds and quality levels. And the main criteria we used for this was just how understandable the words were and how clearly we could hear what Garrett was saying there. And finally, we, at a high level, looked at usability and overall user experience for these platforms. Just how easy were they to use? Did one platform feel really comfortable and another one feel a little bit clunky? So those were some of the features we looked at there. If you want to see more additional footage, please go to our website. You can see that full-length video there. But today we want to talk about a few of the general trends that we observed. So this gives us a little bit more detail as to kind of what was involved in our test. We looked at 8 common video platforms in both web, mobile, and desktop formats. We tested at a variety of speeds ranging from 100 megabits per second all the way down to 256 kilobits per second. And 100 megabits per second is kind of network speed for maybe an organization. This is very fast speed. 256 kilobits per second is a torture test for these platforms. They are not designed to work at this speed, and we were expecting to get pretty poor experience at that speed. We ran at those speeds, we ran a variety of different test sets, including a clean with just no delay or packet loss, with the only variable being the bandwidth changes. A satellite test where we simulated the delay that a user might experience as their signal went from a terrestrial and earthbound location up to a satellite and back down. And we also experimented with a satellite that might be a little congested and have some packet loss. So with a little bit more variable delay and some packet loss. And then it's just a really poor network with a lot of variable delay and quite a bit of packet loss. Next, we can look at some of the trends. So before we kind of go a little bit too far into the results or kind of some of the trends we saw, I'd like to just give a quick frame of reference for what kind of speeds we're talking about here. And a lot of times if we're talking about megabits per second, people might not know kind of what that is. And so one of the references I like to give is it takes about 3 megabits per second to download a standard definition movie about at 720p. So if you're watching on your phone or if you're watching on your standard definition television, about 3 megabits per second is the download speed it takes to watch that. If you're watching an HD movie, it takes about 5 megabits per second. And with that kind of Netflix reminder in our heads, we can use that as a reference as we look at the different platforms. So what were some of the biggest challenges these platforms had to overcome? The first was in just general connectivity. For a lot of these platforms, the hardest part was just getting and staying connected. And the time that it took to connect was one of the things that was a little surprising for us. So most of these platforms averaged a download speed of about 3 megabits per second, which again matches up with our Netflix comparison, and about 2 megabits per second upload speed on an unrestricted network. So that's kind of how thirsty the platforms were. What kind of speeds did they want? But even at those unrestricted speeds, we found that it would take 30 seconds or maybe even more for some of these platforms to connect. So it took a fair amount of time to get the two endpoints connected once both participants hit the connect button. Once we started adding additional bandwidth restrictions or delay or other artifacts like that, that actually became worse. So sometimes it takes a while to connect and to make sure that the patient knows that some of that delay is to be expected as we're connecting. Another challenge that we saw was around poor quality networks. So it's not always just about speed when we're having these platforms connect. And we've all seen kind of what that is. So we've seen bad audio or video, jerky movements in pictures, or garbled audio that comes through. And a lot of times these are caused by network quality issues where we're losing packets, or there's a significant delay in how the information is being transmitted from one endpoint to another. So it's not just the speed that we have to consider, it's also the quality of the network. Finally, we also saw that clientless or mobile solutions had more of a challenge dealing with the low bandwidth or the poor quality networks than their desktop counterparts did. So if you had an application that you installed on a laptop or a desktop computer and you were running through that device, those generally performed a little bit better than some of the platforms we saw that were running on mobile devices or were running just solely through a web browser and didn't have any sort of application associated with them. So we also want to talk a little bit about how the different platforms kind of tackle the low bandwidth restrictions that we applied to them. So each platform had a different strategy that it used to tackle them, but there were some common things that we saw between the different platforms. So in general, all of the platforms that we tested would prioritize the audio of a conversation much more than the video of a conversation. And so in practice, what that looks like is if you have a call and the bandwidth is becoming restricted, the audio should stay nice and clear for a long time before we see any degradation in the audio. But the video might get worse and worse and worse. And that's why when we're on a video call and you're talking to somebody, you can still hear them, but maybe their image will become a little blurry or a little bit jerky. And what it's doing is it's trying to adapt to the reduction in bandwidth. And so it's kind of reducing the video, but it's trying to keep the audio as clear as it can. It looks a little bit different on each platform that does this kind of reduction. And there's kind of two ways that they did it. They would either drop frames or they would reduce resolution. And with the drop frames, what you might see is a clear, crisp image, but the image would seem to kind of slow down and there would be more jerkiness in the movement. So if a person moved their hand across the screen, it might look like that image is a little bit stilted. We call this the slideshow effect because when it gets really bad, it almost looks like somebody's running through a slideshow of photos that they captured kind of at a rapid pace. And you kind of see the person jerk around the screen. So the resolution might still be high, but you're getting fewer of those sliced images. And so it results in that jerky image. The other way that they address this is in reduced resolution. So the image may still be smooth and you may still be able to see the movement, but the actual picture quality will be reduced. And so that may look like blocks of pixels that you can kind of see with your eye, or it may look like just the image just becomes a little bit more fuzzy. Those are the kind of the two ways that they address it. They would either reduce the resolution or they would reduce the frame rate of the image that you're seeing. Finally, another strategy that these platforms would use is to kind of direct you towards downloading some sort of desktop client. So if you're on a mobile solution or you're on a web-based solution and they saw that you were having network connectivity, we had several of these platforms recommend that we download their desktop client so that we can install that. And that gives these platforms a little bit more control over what's happening with the bandwidth. It gives them a little bit more flexibility in how they're going to adjust the signal. So in general, what we saw was maybe even more than the bandwidth limitations, probably the most impactful element to the video that we saw was the quality. So if there was packet loss or if there was significant amounts of delay, that pretty much immediately impacted the video quality and the audio quality, rather than the bandwidth, which is we kind of restricted it more and more and more. It would kind of tear down the quality that we were seeing. So that leads us to a next discussion, is that sometimes when we're looking at getting connectivity for our platforms, we want to think about making sure we have a reliable quality video or reliable quality internet connection over just raw speeds. And that leads us to our broadband discussion on the next slide here. So within the US, the US internet infrastructure kind of has weathered at least the initial brunt of the COVID crisis fairly well. We've had reports from the FCC and other sources that have indicated we've seen about a 30% spike in internet traffic pre-COVID versus post-COVID. So around March, we had about a 30% spike in internet traffic overall. And that's settled down a little bit, but we're still seeing that at a much higher rate than we've seen previously. Early in the crisis, many internet service providers joined with the FCC in signing the Keep Americans Connected pledge. And in that pledge, they promised to not terminate service due to an inability to pay. They promised to waive late fees. They promised to open as many Wi-Fi hotspots to the public as they could. And many actually went beyond that to on cellular plans to boost data caps and to remove data throttling speeds from their platforms. One of the things that we're seeing just recently, though, or fairly recently, is as that pledge ended at the end of June, we've seen kind of an anecdotal rise in complaints of consumers not being able to get the speeds that they need to do telemedicine or those sorts of things. Again, this is kind of anecdotal at this point. We don't have any kind of hard reporting on this, but in general, as that pledge has kind of lapsed at the end of June, we have heard folks are having a harder time getting the throughput that they need. When we talked about consumer internet, and that's kind of the big change that's happened. We've spent a lot of time getting good connectivity to the clinic, and historically that's kind of been one of the primary concerns for telemedicine. But as we move a lot of this care to the patient home, connectivity to the patient home is a primary concern. And for those users in the patient home, there's two kind of key criteria for getting good access. One is one of infrastructure. Does your community, does the internet really come to your door? Do you have the infrastructure built into your internet service providers to get enough speed to do good telemedicine? The second is around access or price. So you could have blazing fast broadband speeds that go to every single user in your community, but if it's priced out of the range that most of your patients can afford, it basically serves as a barrier to care to get that good telemedicine care. So access and price and infrastructure are key concerns. And that kind of brings us to our last point here in the broadband connectivity discussion, is a primary concern that we're seeing is the disparity in broadband access between rural and urban areas. So in 2018, the FCC broadband report indicated that there were still 24 million Americans that lacked access to broadband speed internet. And of that group, 80% were reported to be rural or tribal. We're starting to see major gains in this as reported in the most recent 2020 report, but it goes to show that we're still learning lessons about how important the connectivity is, particularly for rural and tribal partners as we're trying to get care into patients' homes to their door. And Doris is going to talk with us a little bit about some of the specific types of technology that we're seeing providers use as they deliver care to patients in their homes and in their locations.
So one of the many things that TTAC does is track trends in video conferencing equipment. And one of the things that we are seeing is that providers are moving more towards web-based and desktop video solutions. And these video solutions are, audio and video solutions. Most of them are USB plug and play systems. And that's because they're simple, right? They can set up simply, they can do the work simply. And so now Jordan and I are going to share with you some of the audio and video solutions that are available for providers. So Jordan, if I'm a provider and I am providing care, from my office at work or my home office even, and I've got a laptop or I've got a desktop that has a camera and a, an audio solution in it, why would I consider using something external of my system?
It's a good question, Doris. And we do have a lot of providers that are out there that are just using the built-in peripherals on their laptop or on their tablet. And sometimes that can get us the results we want, but in a lot of times, we have a reduction in quality if we use those kind of built-in peripherals, and we can get a lot of bang in our buck by just investing a small amount of money in some of these common USB peripherals, these consumer grade peripherals that'll just improve our audio and video a little bit so that we can have better interactions with our patients. For example, we have kind of the two form factors we're seeing for audio solutions being used on the market right here. The first one that we've seen a lot for telemedicine is kind of this speaker puck design. This setup is designed to have both an integrated speaker and a microphone built into a single unit. It plugs in via USB, and these are pretty good at capturing the voice and capturing sound from an entire room. So if you're working in a small clinical environment, a solution like this will pick up all the speakers in one particular room so that you don't have to worry about who's sitting closer to the microphone and things like that. You put this in the center of the room and generally it'll pick up everybody in the room. One of the growing trends we've seen has been a movement towards USB headsets like this. So as we engage with patients in our homes as providers, so a lot of times the providers are in their homes and the patients are in their homes. Well, how do we kind of limit some of the distractions that we're hearing? And a solution like this is good in that it allows us to use the microphone that's very close to the speaker's mouth to only really capture the audio that's happening that's relevant to the conversation. So, if we've got children studying in the next room or there's a dog barking a little bit further down the road from us, we don't want that sound being kind of transmitted to the patient, and we want our words and our interactions with patients to seem really close and to seem really, really clear. And solutions like this allow us to have that really close, really clear audio with the patient.
So Jordan, you said these are relatively low cost. What are you talking about for these kinds of audio solutions? What would we be paying?
I would say about between $60 and $120 for any of these particular solutions, which is fairly low cost if we look at other kind of video platforms and solutions like that. One of the big things to consider too is these are pretty much plug and play USB compatible. So one of the challenges we have as our providers are doing more and more care from home is we can't send an IT person out to actually have them troubleshoot or get these things installed. So this is something that you could send, or either of these solutions is something that you could send to a provider. They could plug into their USB port and all the drivers and everything's going to load in. They just would need to select that from their video platform. So between the cost and the ease of use, solutions like these are becoming more and more popular.
So kind of along the same lines then, that makes a lot of sense with that audio solution. And, we have a lot of cameras on our desktops anymore and on our laptops, obviously. Why, kind of the same question, why would I consider having an external device connected to my system to enhance my patient experience for my experience for my patients?
Yeah, it's a good question. A lot of this comes down to just sensor real estate. So if you look at the camera that's in your laptop, it's a very, very small camera. It's a very, very small sensor. So it can only really pick up so much light. It can only pick up so much information about what's happening in your space. Even an older camera like this is a 4-year-old Logitech camera. It has a much larger imaging sensor than what we're going to see in most laptops. And it has a more robust built-in microphone. So if you're just using this for your audio and your video, this is going to stand you in pretty good stead. Even though it's an older device, you're going to get better image quality, you're going to get better sound accuracy from a device like this. And there's a lot of lower cost solutions out there. These are really common devices that we're going to see on the market. You're going to pretty much for any of these, you're going to get much better out of the box performance than you're going to get from the built-in speakers in your laptop. What we've seen is the cameras and the audio in tablets have improved vastly, and laptops, we're starting to see some improvement in the quality of the cameras and the microphones that they're putting into those systems. But again, the space is such a premium on those devices that a lot of times that's one of the areas that they kind of fall short in, is having good cameras and microphones out of the box.
So kind of then the same question with regards to the pricing of these video solutions. What are we talking about?
The pricing is really pretty similar to what we heard for audio solutions. Anywhere from about $60 to $120 is going to get you a really decent and kind of a really decent price point for these sorts of solutions. We're not really recommending that people go for kind of the top of the line HD webcams. In general, in most situations, that's just too much bandwidth for a lot of the video platforms that folks are using. Most of the platforms are using the 1080p kind of standard bandwidth. So you're not needing a 4K webcam or anything like that. But a basic 1080p webcam should run you between $60 and $120.
Okay, great. Thanks, Jordan. So now what we want to do is talk with you a little bit about some of the audio and video solutions that are out there that the audio and video is built into the same device, or this is what we refer to as huddle space peripherals. So these systems are generally designed for small or medium-sized conference rooms, but they can be used for one-on-one clinical encounters or even perhaps group sessions. So these technologies, as I said, usually have the microphone and speaker built into it. Some of them will also have an extension mic for like longer, skinnier rooms. And many of these solutions also have a pan tilt zoom functionality. So now Jordan is going to demonstrate for you one of these devices. And the device he's going to demonstrate is the Poly Studio.
Thanks, Doris. So yeah, we have the Poly Studio here, and this is, again, part of that trend of having these huddle space cameras, kind of USB plug and play cameras that give us boardroom level functionality in kind of a single audio video unit that we can kind of just put into a room and set it and forget it. So some of the interesting features for these devices is a lot of them will have built-in pan tilt zoom, and they'll either do that by having a mechanical pan tilt zoom camera, or they'll have a digital sensor that we can use to kind of pan across the room. In this case, it's just taking a very large image, and then it's using that digital, they're just moving the image digitally based on that. It has a built-in speaker puck so that we're actually able to pick up sound from a medium-sized conference room or a large-sized clinic room. And one of the unique features that we're seeing in a lot of these devices that we kind of want to demonstrate for you today is the ability to do active speaker tracking. So a lot of these platforms we're seeing have a technology where using the microphones built into the devices, it's actually able to reframe speakers based on where they are in comparison to the camera. So as we move around the room and as we talk to the camera, it basically can reframe the image based on whoever's speaking at a given moment. We've seen some platforms that are actually able to do this with multiple speakers at the same time. So if you have two speakers in the same room, it's actually able to split the image kind of in half and push two images out to the video platform with both speakers who are speaking from the same room. So this is a quick demonstration. Back to you, Doris.
Okay, Jordan, so just one quick question that came into the chat that I saw. Someone was asking if you were actually moving that camera as you moved, or was the camera tracking you?
Right. So in the first instance, so if I put it back into standard mode, so I have full control over this camera. So using this little remote here, I'm actually able to zoom in. So this is the full field of view of the sensor. So this is as much as the camera can see. So I'm actually able to zoom in and pull in pretty tight on my face. And that is the advantage of having a large sensor. But I'm actually manipulating this manually, moving this around the room. Now, if I switch over to active speaker tracking, it actually should just hone in on wherever it's picking up the audio signal coming in. And again, it can only kind of zoom in on what the camera can actually see, but between the microphones and the speaker, it's able to track where the sound's coming from, zoom in on my face, and it actually does a really good job of centering me kind of in the field of view. So even if I'm not completely centered, it should reframe and put me right in the middle of the picture. And again, we've seen this on multiple different platforms. It's not just this unit, but active speaker tracking is one of the technologies that's kind of popped up in this market space.
Okay, thanks, Jordan.
Yep.
So now what we would like to do is give you a brief demonstration on some mobile peripheral devices. You know, as we talked about earlier, we're seeing a real explosion in this environment. It was actually really moving forward prior to COVID, but since COVID, it's just gone, you know, gone wild. So right now, Jordan is going to provide you with a brief demonstration on 3 of the mobile peripheral devices. They have all been designed specifically for some of them, not all of them. Some of them have been designed specifically to be used on a cellular device or a tablet. So Jordan, back to you.
Thanks, Doris. All right, so we want to show you a variety of different devices here, and they serve different purposes, and they're kind of targeted at different providers or patients. So one of the kind of the only commonality they have is that they all are going to work with some sort of mobile device, a phone or a tablet. So first up, we have the Echo Duo. So this device is going to pair to an Apple or an Android phone using Bluetooth. So it connects via Bluetooth through the Echo app. So you have to use their app to kind of get the step functionality. But what this allows you to do is set up a really kind of straightforward platform for streaming live stethoscopy. So with the app and a tablet on one side of the call, you can actually just stream to a web browser on the other side. So a provider with headphones can just follow the link in a quick email, and all of a sudden they're listening to Steth sounds through the web browser. This device has a built-in one-lead ECG, so you can actually see that trace both on the local side through the app and then also through that web browser on the other side, so you can see that one-lead ECG. You can either use the provided stethoscope earpiece, or you can unscrew this here and just plug in a set of headphones so you can listen locally on a set of headphones. But this gives you a really easy way to stream stethoscope sounds without having to have a lot of dedicated equipment. Next up, we have the TytoCare. This device is interesting in that it's part of a growing part of the market that's designed to be used by the patients in their homes. So this sort of device is a little bit unique in that it's designed to guide a patient through how to perform an exam, to collect that information, and then send that off to a provider. And there's 2 kind of business models that this supports. One is you can buy these from a big box store, and it's actually already connected to a provider panel. You collect the information as a patient, and then you send it off. The other is that clinics can buy these, deploy them to patients themselves, and then point them at their own providers. The device has a nice built-in touchscreen, and it also pairs to a smartphone app. It has sensors built into the device for connecting heart rate and thermometer, so temperature. But we can also attach the soft otoscope and the stethoscope to capture heart and ear sounds, respectively. So this is, again, we're going to see more and more of these devices kind of designed to be used by the patients in their homes. The last device we want to share with you today is a little bit different in that it's really designed more for kind of specialist point of care. And this is the Butterfly IQ ultrasound. So this device will connect to a smartphone. This one is designed to connect via a lightning adapter, so that just plugs into the bottom of your smartphone or your tablet, and you can perform a variety of different ultrasound examinations from this single unit connected to a tablet. So it basically turns your tablet into an ultrasound station. You can do heart ultrasounds, you can do bowel ultrasounds, lung, you can even do obstetric ultrasounds as well. And we actually have a quick video demonstration of this device being used for some venous ultrasounds.
This is a demonstration of the Butterfly mobile ultrasound. The ultrasound footage was recorded from inside the Butterfly app on an iPad. Using the vascular access preset and the color Doppler,
setting, we are able to visualize arteries and veins within a subject's forearms. This demonstration shows that mobile tablets are becoming robust telemedicine platforms, able to support a variety of peripherals and workflows.
So now, last but certainly not least, we want to talk a little bit with you about engaging the patient in their care. So, since we have been moving more and more towards home environment with the patient, we also realize that we need to be more flexible with the patient in setting up that delivery of care. So as we stated earlier, more than likely you're using that patient's device, you're using their tablet or their cell phone, you're using their Wi-Fi or their cellular connectivity. Jordan talked with you a little bit earlier about broadband and some of the issues that we have associated with that, especially in our rural environments. And so we need to recognize that failure is an option. And we need to have a backup plan should our video or audio go down in that particular video encounter that we have with that patient. So if you can, practice with the patient prior to their clinical encounter. That will go a long ways in easing the anxiety that the patient may have. Remember, this may be the very first time that they've done any kind of a video, a video conference with anybody. And, mostly it's been audio. So, and also, if you can't practice with them beforehand, just even when you start your clinical and, your clinical encounter, say, what's a phone number that I can call you back should something happen in this conference call. Now that could, your video could stop, your audio could go down, whatever it might be, but just letting them know that you have a plan in place will ease both the anxiety on both the provider and the patient and will help them to understand that you have thought through all of the issues that may go wrong with the system. And and practice your website manner. you know these patients we need to create a comfortable environment for those patients. We want the technology to be as seamless and as invisible as possible, so making that patient feel comfortable in that encounter will go a long ways with that. So last, we have some key thoughts about telemedicine technology. Your technology should always support your use case. So first of all, decide what kind of telemedicine clinical encounter you want to provide, and then choose the technology that is appropriate for that kind of clinical case. You also want to make sure that you trial the technology before you buy it. A lot of vendors will allow you to trial their product for up to 30 days. And Jordan and I really recommend that you do that. And make sure that you get that technology into the clinic person's hands who is going to be using that technology. If not, I can guarantee you that it's going to sit in a desk drawer and it's going to collect dust. The other thing you want to make sure is that you obtain the support from everyone who's involved in that decision-making process. You want to make sure the clinician is involved in trialing the technology, looking at it, thinking through the processes. You want to make sure that you have administrative buy-in for the technology that you're looking to purchase. And you also want to make sure that IT is involved in that process as well. I don't know how many times I have heard from organizations that they've chosen a technology and then they brought IT into it after the fact, and that has created some concerns. So make sure that everyone is involved, that you have gathered all the documentation, and that you are conducting an informed decision in choosing the technology for your telemedicine program. And finally, last but not least, COVID-19 has made a significant change in how we are providing telemedicine care. As we stated earlier, we're using the technology that the patient has in their home. That in itself can create some challenges that we need to work through and plan for. We talked a little bit about security and privacy, and we need to continually be thinking about security and privacy as we're moving the program from a clinic to out to the patient's home, and that we need to plan past the crisis. So the technology that you are choosing today for this point in time is also going to be the technology that you're going to be using tomorrow or even a year or 5 years from now. So we really need to make sure that we have put in a system that is reliable and usable for you for your telemedicine program for years to come. So how can TTAC help you? You can get a hold of us on our website at www.telehealthtechnology.org. We have a request technical assistance form that you can click on our homepage, and you can fill that out, and we will get back with you and answer any technology questions that you may have. Or you can give us a call at our toll-free number, which is right here on the screen. And at this point, we would like to open it up for any Q&A that we might have. So Joe, are you going to manage that?
Yes, ma'am. Right now, the Q&A is open. Chat box is open. Thank you so much for the info. A lot of good stuff going on out there. And I know there's probably a lot more stuff y'all could have mentioned, but this is really good stuff. And we're going to, just FYI to those in attendance, we are recording today and we will host this on our website. And so while we're waiting for any questions, I also want to encourage everyone to look in the chat box for the link to the survey. Please click on that. Let us know how we're doing so we can improve the processes. Looks like Q&A is, oh, there we go. Are there telehealth technologies that don't require internet access to work?
Pretty much all the technologies are going to need some sort of connectivity, whether that's, and most of them are kind of occurring over the internet because that's the best way to do that. Whether that's, now how we get that connectivity, that might be a cellular network, or that might be a satellite network, or that might be terrestrial broadband. But pretty much most of them are going to be using the internet. We have had a lot of encounters happening recently over the phone, and those have been kind of reimbursed by a lot of federal entities and kind of local entities. But telemedicine mostly is going to be something that we do over internet, with internet connectivity. And that's why the broadband is such an important thing.
Right. For broadband testing that you did, can you talk more about the satellite subscription issues?
Yeah, so I work out of the Alaska Native Tribal Health Consortium. So we have a large part of our population that has satellite, and the challenges, the main challenges with a lot of the satellite connectivity is, number one, around whenever you're having a satellite connection, you're building in delay. So any signal that you send from a satellite location to a satellite and then back, it's going to have about a second's worth of delay. And you really notice that as you talk to folks. Video conversations are kind of strange in that you don't know how delayed our conversation actually is. If you ever want to experiment with how delayed a video conversation actually is, try singing with people on a Zoom call. Everybody sings, but everybody's in the wrong place because there's just delay with how the packets come and go back and forth. But when we're having a linear conversation, you don't notice that. But when you have a significant amount of delay like you have on a satellite, you really start to notice that, especially if the delay is variable, because then things start arriving kind of out of order and it's hard to it starts to jumble things. The other big issue with satellite currently is that for most of the terrestrial satellite that we experience right now, there's just not a whole lot of bandwidth that they can take. So that if you have a community that's completely served by satellite, there's probably going to be prioritization for healthcare and probably prioritization for education. But once we get back down into the patient's home, it gets really, really variable what kinds of speeds that were available, and then what we're going to be able to kind of get. And then the third issue with satellite is just it's really, really expensive at this point. We are following kind of some of the advancements with technologies like Starlink, which are low Earth orbit satellites, where they put up a lot of satellites. So at any given time, you have several satellites that are being used to send information back and forth for any given person. And this has the promise of getting us connectivity in really rural locations all over the world, actually, like Africa and South America. We have the potential to get really good speeds for telemedicine. It's going to be interesting to see what the cost and the hardware requirements are around that. So that's a technology that we're really looking forward to seeing kind of come into fruition.
Okay, we got another one here. It's kind of related. Do you anticipate the Skylink endeavor making a difference in the latency for your sites?
Yeah, latency is better just because the satellites are closer. These are much closer than the geostationary satellites that we have that provide a lot of the service now, or the polar orbit or southern orbit ones that provide it for the northern for a lot of folks. So yes, it's going to make a big difference in terms of latency and just raw speed, because we have the multiple satellites on any given user. We're going to be able to see more kind of network speed, just throughput. So yeah, I really am interested in seeing. I'm really curious. The initial tests that they've been doing have been putting this in the 40 megabits per second download speeds and about 10 megabits per second upload speeds, which is good speeds for video connectivity. My real questions are going to be around business model, pricing, and then what kind of dedicated hardware are you going to need to actually be able to get access to these networks? And if you buy in, so those are the kind of the main questions I have around that.
Okay, so follow-up question: what is the average meg per dollar cost that Alaska experiences?
I don't have that information here. We can definitely look it up for you, and it's really, really variable. One of the issues that we have is Alaska is very, very vast, and a lot of communities are served by different plans and different pricing, and a lot of services we've actually been able to get a lot of fairly remote communities served by terrestrial cable. So the pricing for those locations is a lot lower than those served by satellite. But yeah, I don't have any kind of dollar per community. It would vary by community, and it would kind of vary across the state. But I do know it's very expensive, and it's pretty highly subsidized too by the federal government. And if we didn't have those subsidies, those USAC subsidies, it would be priced out of the range of pretty much any consumer.
Okay. Not seeing any more questions come through. Unless anybody else, last call for questions. Otherwise, I'd like to thank Doris and Jordan. Thank you so much for your time and talents today. Very robust and worthwhile information that, again, we're going to be hosting on our website. And so check out the Telehealth Technology Assessment Center website. Great free resource. Feel free to check out the South Central's website. We're here for you. We're free. Use us. Let us help you find what you need. So thank you so much for attending. Stay safe out there.